Hey everyone, and welcome to Dr. NovaPods. Today we are going to learn about thyroid embryology. The thyroid originates from endodermal tissue of the primitive pharynx. It appears around the fourth week of embryonic development. The thyroid diverticulum forms, eventually growing downward into the neck. At the seventh week, it migrates anterior to the trachea. The thyroid gland begins its journey at the base of the tongue, from the foramen cecum. The thyroid diverticulum forms from the floor of the primitive pharynx during the fourth week of embryonic development. It grows downward through the thyroglossal duct, eventually forming the thyroid gland. As it descends, the thyroid moves in front of the hyoid bone. By the seventh week, it reaches its final position anterior to the trachea. This descent is crucial for proper anatomical alignment within the neck. Understanding this process helps in identifying congenital anomalies. The thyroglossal duct connects the developing thyroid to the tongue and typically involutes between the 8th and 10th weeks of gestation. The foramen cecum remains as a remnant of this duct in adults. Persistence or abnormal migration of this duct can lead to pathologies like thyroglossal duct cysts or ectopic thyroid tissue, which we'll explore in detail in the next slide. As you can see, the remnant of the thyroglossal duct, which normally involutes and disconnects from the tongue, may persist. If it fails to regress, various clinical anomalies can result. In the table shown, we observe 4 common outcomes: thyroglossal duct cyst, sinus, fistula, and ectopic thyroid tissue. Thyroglossal duct cyst presents as a midline neck mass that moves with swallowing or tongue protrusion. It may become infected or fluctuant. Thyroglossal duct sinus is an external or internal draining tract which may release mucus or pus, especially after infection. Thyroglossal fistula is a persistent epithelial-lined tract. It can be congenital, post-infective, or post-surgical in origin. Ectopic thyroid tissue, most commonly found at the base of the tongue, lingual thyroid, may be the only functioning thyroid tissue in some individuals, making diagnosis and management critical. Follicular cells arise from the endoderm and are essential for the production of thyroid hormones, T3 and T4, which regulate metabolism, growth, and development. Parafollicular cells, also known as C cells, originate from the neural crest. These cells secrete calcitonin, a hormone involved in calcium homeostasis by lowering blood calcium levels. Thank you for watching. Please like, share, and subscribe to Dr. NovaPods. You can also follow me on Instagram to get the PDF notes from this video.